Hi, I'm Dr. Chris Ward with the Dental Implant Center of Oklahoma. A question I'd like to address today is the question when patients come into their consultation, they're trying to gather information because they want to know what's the best option for them. And those things include what price points and how much of an investment do I have to look at to try and restore my mouth. And so there's two primary options that we talk about a lot. One is whether we do a removable option or we do an option that's attached that doesn't come in and out. With that, there's a lot to that question. The removable option is the one I primarily want to talk to at this point. Removable, you have what we term in the industry as an RP4 or RP5. And RP4 means that there are certain types of connectors that are used on this denture or this removable teeth apparatus that we have, that when it's in place, it doesn't move and it's solid, and it's almost as solid as if it were fixed when it's in your mouth. Then there's an RP5, and that's the more traditional removable option where there's implants placed depending on the number and which jaw you're in, but they have snaps that basically when the denture's in, it snaps onto those implant connections and it holds the denture up or holds the denture down depending which arch. They're great from the standpoint of not letting a denture fall out of your mouth. And that's, the embarrassment with that. It's also going to hold the denture in a relative position. You're not going to be able to chew the same amount of food because it does move, and the support for that is still your gum tissue. It keeps it from coming up, but the pressures against your gum tissue are still going to be the same with an implant retained denture as it is with a regular denture. So the advantage that you get with it not falling out is great. The downside is it still gets food caught under it. It's going to be bulkier because it's a denture. It's just held in so that it snaps in. Now, when we go from that, the RP5 to the RP4 is solid when it's in there. There's a bar that's fabricated that is made to fit however many implants there are. Typically, there's 4 or 5 implants that this bar is made to screw into directly, so they all work as one piece. Then there's specialized clips or attachments that are used where it can attach to this bar so that when it's in place, it doesn't move. It's solid, and the support for it is solely the implants and the bar. It's not the tissue at all. There's not a lot of difference between that and a fixed hybrid where we fabricate a bar, but we screw it in and we leave it in where it doesn't come in and out. The advantage to the RP4 is for patients who have limited dexterity, where they can't really clean under it well, and we want this to last. So if it's a removable situation where there's a way to remove these teeth, then I'm just brushing a bar or brushing the implant pillars or much smaller apparatus, and then I can reattach the teeth. So from a cleansability standpoint, it's a much better option for someone with limited dexterity. The cost for that versus an acrylic hybrid is the same. It's the same. It's actually a little bit more complicated sometimes to make a bar with something removable than fabricating it together. So from a cost standpoint, there's not a lot of difference in the two, but there are indications for the removable RP4 apparatus. Hope this was helpful.